I'm checking the door signs for any NPO, isolation, fall risk, fluid restrictions, or daily weight.
Come in.
Hello, my name is Rebecca. I'm a student nurse from South Florida State College. I'm here to do your head to toe today. And I've cleaned all my equipment prior to coming in. Okay? Going to put my barrier down, write my name up on the board so you know who to call for. And I'm gonna go wash my hands. Can you tell me your first and last name and date of birth?
Teresa Leader, July 13th, 76.
Do you have any allergies to latex?
Yes.
Do you have any other allergies?
No.
I'm going to evaluate the overall appearance of the room. I'm going to make sure the bed is in the lowest position, half side rails are up. Is it okay if I bump your bed?
Yes.
Okay. Alright, before we get started, do you need anything? Do you need to go to the restroom? Do you need any pain medications? Or are you comfortable?
I'm comfortable.
Okay, I'm going to raise the bed up. Okay. I'm going to start with your vitals. Have you had anything hot or cold to drink in the last 30 minutes?
No.
99 degrees, 99.0. And I'm going to do your thing, your heart rate. So I'm going to clean my stethoscope, go underneath the gown. It's 80 beats per minute and it's regular. All right, I'm going to do your blood pressure. Do you know what your blood pressure normally runs?
No.
No? Okay, I would looked at the patient's chart prior to coming into the room to know baseline vitals. Have you had any accidents or injuries to either arm?
No.
Have you had any breast or chest surgery?
No.
Do you have any circulation problems?
No.
I'm looking for dialysis ports, and I'm looking for IV. It's on the right hand, and for any type of edema. All right, just lay your hand like this. Clean my stethoscope. All right. (100/60). Is that usually normal for you, or kind of?
Yes.
Okay. I'm going to check your pulse. The respirations. I'm going to check respirations right now. (18). And I'm going to check your oxygen saturation. 98%. Okay. Are you experiencing any pain right now?
Yes.
On a scale from 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt, can you rate your pain?
8.
When did it start?
I don't know. It's always hard.
Okay. And where is the pain at?
All over.
All over. And how long does it usually last?
All the time.
And what does it feel like? What can you describe your pain?
Achy.
Achy. And what makes it worse?
Walking around.
What makes it better?
Relaxing.
And are you currently receiving any type of treatments for your
Yes.
pain? Okay. Pain medication? Or
Yes.
giving? Okay. That helps a little bit. All right, I'm going to check your IV. I'm going to check for the gauge of the IV, check the dressing, make sure it's intact, redness or swelling, I'm going to check, and if it's warm, and any type of fluid around the bandage also. I'm going to check the pain, so do you feel any pain at your IV site? All right. I'm going to check the clamp, make sure if it is unlocked, it is continuous fluids, and if it's locked, it is a saline lock. I'm going to check the tubing for any types of bubbles or kinks. Check the drip chamber, make sure it's half full. I'm going to check the bag that is the fluids that are hanging. So I'm going to check the type of fluids, the color of the fluids, the amount left in the bag, the expiration date, and if the bag has been hanging for more than 24 hours, I would notify my RN. And I'm going to check the pump to see what it's running at. I'm going to check your oxygen. So I check the make sure the nasal prongs are down in the nares. Check inside the nares to see if there's redness or irritation. I'm going to check on the cheeks and behind the ears for any type of redness or irritation. I'm going to check the tubing, make sure there's no kinks in the tubing, and I'm going to check the flow rate of the oxygen. The catheter, I'm going to check the size of the catheter, make sure it is attached to either side of the leg. I'm going to check the tubing to see if there's any urine, and if there's urine, I will check the color and clarity of the urine in the tubing. Make sure the bag is on the bed frame, and I'm going to check the amount in the bag, and I'm going to change my gloves. All right, I'm going to check your the size of your eyes. So before we get started, do you know where you're at right now?
Sebring Advent Health.
And what is today's date?
April 2020.
Okay. And I'm going to check your pupil size, okay? So just look straight at my nose. About 5. Keep looking at my nose. I'm going to shine a light in your eye. Alright, I'm going to check for facial symmetry. So can you open up your mouth, stick out your tongue, and say ah? I'm checking for oral mucosa for make sure it's pink and moist. Do you swallow okay?
Mm-hmm.
Okay. And I'm going to check for skin turgor. Less than 3 seconds. Okay. I'm going to clean my stethoscope once again. Do you have any difficulties breathing? Do you have shortness of breath?
Yes.
Okay. And I'm checking to see for use of accessory muscles. And I'm going to ask if you have any mucus built, like when you cough, is there mucus or is it dry? There's nothing coming up? Dry? Okay. I'm going to go clean my stethoscope, go underneath the gown. Take a deep breath in and out. Alright, I'm just going to get right here. Alright, can you lean up for me? Okay. Take a deep breath in and out. I'm going to check your abdomen, okay? So I'm going to inspect the abdomen, make sure there's no abnormalities. I'm going to clean my stethoscope, go underneath the gown, and auscultate the abdomen. Okay. I'm going to palpate your abdomen, so just let me know if there's any pain or tenderness, okay? Looking at the patient's face. Okay, no pain. All right. When was the last time you had a bowel movement? When was your last bowel movement?
This morning.
This morning. And how much was there?
Medium.
What was the color?
Brown.
What was the consistency of it?
Brown.
Okay. And have you been passing gas?
Yes.
Are you having any difficulties urinating?
No.
Okay. Can you squeeze my fingers for me? There you go. Let me look at your hands. Move your fingers. I'm checking for the color, capillary refill, the temperature, and the pulses. All right, I'm gonna push up against your arms, so just push up against me, okay? Push down, okay? Push up, push down, push up, push down. Okay, I'm gonna move your toes for me. Okay, and I'm checking the color, the capillary refill, temperature, the pulses, also checking for edema, checking the heels. Okay, change my gloves. I forgot to check for edema in the hands. So, checking for edema in the hands. Are you experiencing any type of numbness or tingling anywhere in your body?
No.
All right. So, I'm going to make sure I have everything before we roll you over, so we can look at your backside. Make sure I didn't miss anything. All right, I'm going to check for telemetry real fast. Okay. Okay, we're going to get you rolled over. Okay, can you roll for me? Okay. I'm going to check the backside for any type of redness or irritation or any type of skin issues. All right, roll back. All right. Alright, I think we're finished with the head to toe assessment. Okay, are you feeling good?
Yes.
Alright. I'm going to lower the bed and put the half side rails up. Here's your call bell. Where would you like your bedside table?
Right there.
Right there? Okay. I'm going to ensure that make sure that overall appearance of the room is clear. So to use this call bell, you're going to press this button right here, okay? And it will alert me that you need help or you need something, okay? And I will be there as soon as possible. I'll also be back within 1 hour to check up on you, okay? Okay. Are you comfortable? Do you need to use the restroom? Do you need any pain medications? Comfortable? Good? Before I leave? Okay.
I'm good.
All right. Awesome. Okay, I'm going to clean my equipment before leaving. Change my gloves and wash my hands. All right. Thank you for allowing me to be a part of your care today. Would you like your door open or closed?
Open.